I love being able to break down the barrier and let them know, like, it's okay.
The grant is a federal grant from HRSA, which is the Health Resource and Services Administration.
Educate them on the barriers of the vaccine, the pros and cons of vaccines, and to provide vaccines to these communities.
It was to focus on community zip codes that had high vaccine hesitancy rates, low vaccination rates.
We looked at the grant opportunity ourselves when it first came out, but I knew HRSA was looking for a bigger system, which Dignity is, and a larger collaboration.
The beginning process was looking at who at that time was eligible for the vaccines and who treated that population, who was trusted with that population, and then bringing them on.
We work with the senior population and their families, so I know that was something that the population we serve wanted to go to a trusted organization.
For our unhoused populations, we would meet them on the streets in their tents.
Throughout the 6 organizations, we got to staff 19.5 people, some part-time and some full-time. They really wanted to focus on hiring people that lived in the community so that it would be culturally and linguistically appropriate so that we could build trusting relationships.
Most of us are from this area, you know. We grew up in the San Fernando Valley, or we have family members and friends here, so for us it's personal.
I think it was important for all of us to give back to the community.
My dad is diabetic. I kind of became like the central hub of information for my family. So it was, you know, everyone, like my cousins, my aunts were having questions, and I would kind of present them how I would present, but make it easy enough for them to digest.
3 of my family members passed away because of COVID-19. I knew that if they had more information and more knowledge on how to be safe, whether it be with the vaccine or just wearing masks, maybe they would still be here today.
We did a lot of phone banking to our families, to our seniors, and a lot of them appreciated it. If we hadn't called them, they wouldn't have made the appointment.
When I do canvassing and I give a flyer to a community member and they're like, oh, that's great, because I've been looking for a place to get vaccinated, I just don't know where, or where, I didn't know if there were still clinics around.
Recibí un correo de la escuela de Birmingham y decidí venir. Me dieron fácilmente una cita y decidí venir a ponerle la vacuna a mi hija.
I'm on the email list for the nonprofit that is co-hosting this.
They're very excited that they are able to, receive a COVID-19 vaccine, but as well, in addition to that, they get an incentive. $25 gift card.
My son who got vaccinated, Brendan, is very excited about the Jamba Juice and Starbucks gift cards he got. She also wants the swag. She's a little less apprehensive.
I was hoping to get vaccinated. I was just dragging it to avoid making an appointment. Because the city is so convenient and everyone was so easy to talk to and friendly.
They make it more accessible and comfortable and smooth and an incentive.
A la comunidad que aprovechen a venir acá a ponerse las dosis que les hagan falta. Hay un equipo bien completo y muy amables, por cierto, que nos atendieron muy bien.
We appreciate the work we do and how it doesn't go unnoticed in the community, because oftentimes all the community member needs is for someone to tell them or remind them.
It's always exciting when you get those individuals who are like, yes, it's my turn.
Especially now that we're like a little bit past almost 2 years into the pandemic. I definitely feel like seeing people come in to get vaccinated for the first time is a really big success story for us.
Tell my own family members, we have a vaccine clinic this Saturday, and then themselves become the community health workers too. They're telling others and putting it on Facebook.
The line went around the block and there were hundreds of people, and that particular day I thought, wow, we're doing a great job.
Through Joni Novosel and our Center for Healthier Community, the many collaborative partners that we have in the grant, and those organizations that gave us the opportunity to come into their parking lots, into their homes, into their places of business to be able to set up the vaccine clinics, those were critical to the success of this program.
Due to this staff that was working on the Vaccinate LA Collaborative, over 7,000 people were vaccinated and over 6,000 of those 7,000 are fully vaccinated.
We'll never really know the number of deaths we've prevented or the number of hospitalizations prevented.
Just knowing that patients leave happy and feeling safer, that's ultimately like my personal goal and our whole mission here.